I'm Needham.
And I'm Kirsten Cummings.
And we're from the Cascade FFA chapter. Today we will be showing you different types of dystocia in sheep.
The sheep industry is a big one and growing even as we speak. There are multiple different whether it is a clubland or commercial sheep operation, there are still problems that arise. One of these problems in this species is dystocia, or difficult lambing. Today we will be showing you some keys to successful lambing, tips and keys for successful lambing, and 6 different types of dystocia as well as normal presentation. There are 3 stages of labor. First, ewes will often engage in nesting, pawing at the ground, straining, or just acting nervous and uncomfortable.
Keys to successful lambing. Number 1, you always want to have a clean workspace and try to minimize infection as best you can. The best way to do this is to use a sleeve when assisting a ewe. This is just a glove that will go all the way up to your shoulder. You also want to be able to use lube, which helps minimize infections when using the sleeve.
The next supply we have is Survive, which is a vitamin E and energy supplement, and iodine, which you will spray on the navel of the lambs to minimize infection.
You also want to be patient. Acting too early can cause problems that might not be fixable.
And then the third key to successful lambing is to have an imagination. As you know, you can't have x-ray vision inside the ewe, so you're going to want to use your hands to merely touch and feel the inside of the ewe and the position that the lambs might be in.
As Kirsten previously stated, there are 3 stages of labor. Stage 1, which often occurs with uneasiness, kicking, and pulling at the ground, lying down and getting up frequently. This lasts between 1 to 8 hours. This ends when the lamb is in the ewe's pelvis.
In stage 2, these are when the visible signs of birth are often seen. This can be the appearance of the water sac or the evidence of a foot or leg in the birth canal. This stage usually lasts between 1 to 2 hours or 15 to 30 minutes per lamb and ends with the birth of the lamb.
Stage 3 is the final stage. This is when the placenta is passed. Normally this is 15 to 20 minutes after birth. Sometimes ewes will eat the placenta, which releases oxytocin, which helps in milk letdown.
So some types of dystocia we will show you today is normal presentation, which is not a type of dystocia, but we will still be demonstrating it. And then we have elbows locked, one leg back, head turned back, breacher backwards, and then twins with 4 legs in the birth canal and a head, or twins with 2 front legs, a head, and 2 back legs.
The causes of dystocia is when there are large lambs, twins coming at the same time, the size of the ewe's pelvis is when it's too small, ewe's failure to dilate, and when first-time ewes are the ones that normally have problems.
So before you want to start assisting a ewe, you're going to want to put on your protective sleeve. This will go on your dominant hand and it will go all the way up to your shoulder. Next, you will, if necessary, you will need to put lube on your hands, which we will not show you because it will obviously make a mess. But then the first type we will show you is normal presentation. In this position, ewes normally don't need help, but if they're not making any progress within the 40 to 60 minutes that birth has started, then you might want to assist the ewe. In this position, you will see 2 front legs and the nose. You will want to apply a firm, steady, gentle grip on the lamb's front legs, and then continue to pull the rest of the lamb downwards.
You want to make sure to wipe off the lamb's head and nose with an unscented towel.
This will make sure that their airways are clear and that they can breathe. Next position is the elbows locked position. This is when the elbows are locked in the ewe's pelvis or birth canal, and their front feet are typically pointed straight down. So what you first want to do is push the head of the lamb back into the ewe, and then pull the front legs out one at a time to make sure that they're extended. Then you'll continue to pull the rest of the lamb out once it's been put in the normal presentation position. Now our next position is one leg back. If the lamb is small, the ewe may not need a lot of help. But if it's a first-time mom or the lamb is especially large, you're going to want to use that imagination and slide your hand along the shoulder of the lamb and find the hoof that's turned backwards. Make sure you put your hand over the hoof and pull it forward without being sure to not penetrate or nick the inside of the ewe's birth canal. Then once the feet are in the normal presentation, you will continue to pull the rest of the lamb out like so. Next position we have is the head turned back position. This can be caused by a small pelvis, large lambs, or the ewe's failure to dilate. In this position, proceed by putting your hand inside the ewe and wrapping your hand around the top of its head and turning it back into the ewe's birth canal to where it's in the normal presentation. Once it's in this position, you can usually pull the rest of the lamb out normally. When discarding these sleeves, be sure to throw them in the trash and do not double use them.
The first type of dystocia that Kirsten will be demonstrating you today is backwards. It is important to remember not to turn the lamb all the way around into the normal presentation. You also need to act quickly but gently. Start by put a steady, firm grip on the two back legs and start by pulling the lamb upwards. Once the lamb's pelvis is out, then start by pulling downwards. It's important not to pull downwards too early as the lamb will get wedged into the birth canal. The next type of dystocia that Kirsten will be demonstrating is with twins, when there's two front legs in a head and two back legs coming out at the same time. Act quickly but gently. While multiple births are not uncommon in sheep normally have between 2 to 3 lambs. Before making any sudden moves, make sure you go in and feel around to see what's coming out first and what's coming out second. It's important to know what legs belong to what lamb. Once you have an idea of what's coming out first, try to pull the normal presentation lamb out, being sure not to get it wedged into the birth canal. After the first lamb is out, go in and check to make sure you have the back legs of the same lamb, and go ahead and pull out. If they are untangled, it is important that you untangle them and don't start too soon when you have one leg of each lamb. The next set of twin dystocia that Kirsten will be showing you today is when there's 4 legs and 1 head. This one is quite a sticky situation. Oftentimes, it may take a little bit to figure out. First, you want to go in and make sure you know what you have. This is the one that takes the imagination. Start by pushing both lambs back, making sure there's enough room to pull out the lamb that's in the normal presentation. Once you know what you have, go ahead and pull out the first lamb out. Going in to get the second one, you want to make sure you go in and turn the head around into the normal presentation. Make sure you have the 2 front legs and go ahead and pull the second lamb out. Common mistakes that may arise is allowing the mother to be in labor too long before giving assistance. This may cause a higher percentage of death rates in birthing lambs. Also, trying to intervene too early may also cause a higher percentage of death in lambs without correctly identifying what parts you have. With twins, pulling limbs that belong to different lambs may also cause problems.
Now, once your lambs are born, you're going to want to do some follow-up or aftercare. Once the lambs are born, you're going to want to make sure that your ewe is up and there's no more lambs left in her. Then you'll put her lambs in front of her face and make sure that she is cleaning them and licking them off. Also, once your lambs are born, maybe a couple of hours afterwards even, you're going to want to use that Survive and put it into their mouth, making sure that their tongue is down so you don't get it into their airways, and that you have sprayed iodine on their navel to prevent naval infections. And also, you want to make sure that your ewe has plaster placenta. This is very important in making sure that the birthing process is done. And if any further bleeding occurs from your ewe, it might be in your best interest to consult your veterinarian.
In conclusion, there are many things we can't do to help with sheep dystocia, but we can help eliminate the problem and the percentage of death. during labor.